Hello, my name's Helen Kendrew and I'm the matron here at Bath Fertility Centre. And a number of patients speak to us who might be thinking about IVF treatment and wondering what exactly happens. So I'm going to give you a quick run through what happens when you're having IVF treatment. So your first appointment here would be with one of our consultants, and what they would do is draw together all your investigations, make sure your blood results are up to date, and we'll plan the treatment of choice with you. They'll also run through the injections that you're going to need to start taking and get you to complete quite a lot of consent forms, I'm afraid. And you should expect really to be here for about an hour having that consultation with the doctor. We'll then make an arrangement for a company to deliver the medication to either your home or your workplace. They are quite discreetly sent. They come in a nice brown paper parcel. They're not screaming fertility drugs on top of them or anything like that. And you can arrange to have them come to your home, your workplace, your partner's home, workplace as well, if that suits you best. You'll then start a course of injections which are going to switch off your hormones, and we anticipate that your period will come a certain time after you've started those injections, and then we'll plan for your second visit here, which will be for a scan to see if you're ready to start the actual fertility or egg growing injections. That ultrasound scan would be done by one of the nursing team here, and if everything is fine, we'll be giving you the go ahead to start your egg growing injections. We'll see you then for your third visit about 10 days later, usually a Friday and usually in the morning. And at that point, one of the nursing team will scan you to assess your ovaries to see if they've responded well to the fertility injections. And it could be that we're in a position to plan with you for your egg collection in the beginning of the following week, or it might be that you need to come back for a further scan after the weekend. So your fourth visit might potentially be for the egg collection. You and your partner will come around about 8 o'clock on the morning that we decide that your egg collection is to happen, and you would expect really to be here all morning. The egg collection itself is done using some very nice drugs, a painkiller and a sedative, and generally most women find this quite manageable. And then you'll be able to go home around about lunchtime to rest in the afternoon. Your next visit here would be for the embryo transfer, again undertaken by one of the nursing team here, a bit like a cervical smear, not quite as uncomfortable, a much more gentle procedure, and you'd be here for around about an hour all told. So at the end of the day, if everything goes according to the plan that I've just mentioned, you could expect probably a minimum of 5 visits throughout the course of treatment, and most people manage to juggle work and hopefully home life through that, and we completely understand that we need to try and be as helpful as possible.